Hello, welcome. This webinar is being recorded, and I want to thank you for attending and for looking at this in future. Um, I would like to remind the attendees to remain muted when they're not speaking. Um, the recording will be posted on our website and YouTube channel, and it will also be sent to all registrants. This webinar is hosted from Indakana, which translates as our homelands and is currently called New Hampshire and Vermont. Indakana is the unceded traditional ancestral homelands and waterways of the Pennacook, Abenaki, and Wabanaki peoples, past and present. We acknowledge and honor with gratitude the land, water, air, flora, and fauna, and the beings who have stewarded Indakana through the generations for over 12,000 years of human habitation. We're very happy to welcome Dr. Jonathan Patz, who is a professor at University of Wisconsin-Madison, chair of their Health and the Environment Department. He's a chair of Health and Environment. He has many degrees, an MD. He's a family doctor, as well as a occupational and environmental health medicine boarded physician. He has a PhD and a master's. So he's twice over doctors and a master, twice over doctors, a master in public health from Johns Hopkins. For the past 25 years, he's taught and conducted research on climate change and has published over 200 scientific publications, several textbooks. He's also in 2019 was elected to the National Academy of Medicine. And way back in 1994, he was convened the first ever session and wrote the first policy resolution on climate change with the American Public Health Association. He's also co-chaired the health report for the first congressionally mandated U.S. National Assessment on Climate Change. And in fact, Dr. Patz, we had a petition here in New Hampshire to our congressional representatives, our two senators and two congresspeople, about the decision by the Trump administration to stop supporting the writing of U.S. National Health Assessment on Climate Change. And we were outraged and brought it to our congressional delegation, which in this purple state just happens to be Democratic, whereas the state government is all four bodies, kind of the executive council, controlled by Republicans. He's also participated and been a lead author in the IPCC reports, Intergovernmental Panel on Climate Change. And all his other accomplishments are too numerous to list right now, but can be read from our website in the events section. So I will turn, with that introduction, I will turn it over to Dr. Patz, and you can write your questions in the chat or have a time to raise your hand for questions after the talk. Thank you. Welcome, Dr. Patz.
Paul, thank you very much. I really appreciate the invitation. And thanks for the audience there. I'm going to quickly share my slides here. So does that look okay? Looks
Yes.
good? Okay, great. Thank you. Okay, so I'm going to dive into the subject of climate change. I'll talk a little bit about the challenge of climate change. I'm sure most of you know the health effects of climate change, but then I'm going to show you why climate action really can lead to huge health benefits and should be considered health intervention. So we know that burning fossil fuels leads to the buildup of greenhouse gases. Climate change, you can see the evidence of the largest, most abundant greenhouse gas is carbon dioxide, and it's actually continues to go up. These measurements are measured in Hawaii. These are actual measurements over time, and you can see that we just continue to march forward on this most abundant greenhouse gas, carbon dioxide. And we're seeing consequences. Last year when Phoenix had 100 days over 100 degrees, that was a record. And last year was the warmest year on record, according to the World Meteorological Organization, the WMO. And the physical attributes of climate change, rising temperatures, sea level rise from thermal expansion of salt water, and land-based glaciers sliding into the ocean, but also extremes of the water cycle, more droughts, floods, and fires. And those physical attributes of climate change affect our health through multiple pathways, be it more directly through heat waves, especially in cities, the urban heat island effect, air pollution and aeroallergens, infectious diseases, both waterborne and vector-borne diseases, food resources, water resources, and mental health and forced environmental refugees. So there are these major pathways through which climate affects our health. And on the right side, you can see various examples of these climate sensitive health outcomes and diseases. So just to start on temperature, I don't know if you all remember the summer heat dome of 2021 that hit the Northwest. Extremely hot temperatures. You can see, temperatures got into the hundred and teens. In Linton, British Columbia, it got up to 121 Fahrenheit, and then the town combusted, just went up in smoke. It's estimated that over 700 people died in British Columbia, over 600 in Washington and Oregon. And this was an extremely hot event, especially for that region. And statistically, today's human-caused warming, like the one degree centigrade average climate warming, increased the likelihood of that extreme event by 150-fold. In other words, that event, as hot as it was and as extreme as it was virtually impossible to have happened without human-caused climate change. So now we're able to, through the World Weather Attribution Initiative, where we have a better ability to attribute some of these extreme disasters, some of these extreme weather disasters, to human-caused climate change. Other effects of warming, we're seeing changes in the ragweed pollen season, especially in northern latitudes like New Hampshire and Wisconsin. It's 13 days longer now because of warmer temperatures and also more CO2 in the atmosphere. But some argue that global warming's greatest threat may also be the smallest. And here, think about the difference between us mammals, we're warm-blooded, and that mosquito who is cold-blooded. And so that means that whatever the air temperature is around this mosquito, that's her body temperature. This mosquito, Aedes aegypti, carries yellow fever, dengue fever, and Zika virus. And it's not a surprise that when Zika virus erupted in the United States and throughout Latin America, also along with a record-breaking dengue fever epidemic, that there were some temperature changes. And in fact, right before that happened, there was a very strong El Nino that winter of 2015 into 2016. And temperatures were more than 2 standard deviations above a 60-year average temperature. You can see that on the map, just the hot temperatures all over the place. And that's right before Zika erupted. It turns out that Zika virus, like dengue fever, like the dengue virus carried by the same mosquito, is very sensitive to temperature, even more sensitive than dengue fever. So the question is, did that El Nino bringing the warming temperatures have something to do with enabling the Zika virus to take flight? There are so many ways that extreme weather affects our health. Many of them are infectious diseases. So we're looking at on the left column, warming, precipitation, floods, leading to vector-borne diseases, mostly insect-borne, waterborne diseases because of extremes in precipitation, but also a few non-infectious diseases, airborne diseases, direct contact like poison ivy. So how many pathways do you think uh, we were able to find in this systematic review that link extreme weather with human pathogens? Well, this team found over 1,000 pathways through which climate affects our health. So this is why, I view this as one of our most daunting public health challenges of our times. The other thing with temperature is that we're going to see more intense storms. Um, this is a relationship between the strength of hurricane winds, that's this PDI, the Power Dissipation Index, um, against the sea surface temperature. So the green and the blue, they are lockstep related. And we know from simple physics that warmer sea surface temperatures drive stronger hurricane winds. What made Hurricane Helene a historic storm? Well, it was the sea surface temperature, extremely hot temperatures. And Hurricane Melissa, that reached wind speeds never seen before in Jamaica, clocking it at 185 miles per hour. Well, the sea surface was much hotter than usual, more than a degree centigrade higher than normal. So no surprise with the hot temperatures, the hurricanes are stronger. But remember, it's not just temperature, it's extremes of the water cycle. This is a map showing the changes in heavy rainfall amount. My state of Wisconsin now has 7 inches more rainfall per year than it did 50 years ago. And you can see there are many health impacts from flooding. Um, we did actually a study looking at the water quality in Chicago and knowing because warm air holds more moisture, when it rains hard. And you get these combined sewage overflow events when systems can't handle all the stormwater, and you get these overflow of sewage contaminated stormwater that overflows into our lakes and streams. What we're going to see in the future, especially for Chicago anyway, the heavier rainfalls will double the number of those contamination events. And already in the United States, we have over 1 trillion gallons of sewage combined stormwater that overflows into lakes and streams every year. That number is going to increase with the increase in the intensity of rainfall because of climate change. But what we see coming into the emergency room after a flood, it's not diarrheal disease, it's asthma. And this is what you would see after a flood situation where people are cleaning up the mold. And if you live in a low-lying area, it's quite likely that you may not necessarily be quite well off. And in fact, a racist past, flooded future, formerly red line areas are at the highest risk of these flood events and the risk that you can see here. And if you were black living in America a long time ago, you were, no matter how much money you had, you were not allowed to buy a house in more favorable neighborhoods. And of course, investment in green space and things like that happen in the non-red line areas. So this is something at risk from flooding The same thing is true with the urban heat island effects. Formerly red line areas also are more risk of more intense heat waves when a heat wave hits the city. So going back to that 2021 heat dome, not only was it record hot, but it was also record dry. And the extreme drought conditions led to wildfires. And you can see that this is, affecting the entire country. And wildfire smoke is pretty hazardous. Now, in a couple 2 years later, in 2023, you probably witnessed the fires from Quebec, and they affected the whole area where you are. New York City became the most polluted city in the world in June. This is looking at the air quality when that wildfire smoke got down to New York. You can see dangerous levels. And if any of you want to know what those colors are, those are along with the air quality index. You can see the purple is very unhealthy. Dark maroon is hazardous. And you can see, lots of purple and maroon there in this image. So really significant wildfire smoke. Well, how dangerous is it? Well, first of all, I'll just say that we're seeing more and more exposure. Americans are exposed to more smoke. Look how much in 2023. And if you're a child, a young child, there are studies that show that wildfire smoke is extremely dangerous, 10 times more harmful than other sources of particulate pollution. Also, looking at studies out of Australia, where they've studied bushfires, the risk also is for pregnant women and exposure to wildfire smoke when you're pregnant, especially in the third trimester, leads to adverse birth outcomes. So this is not a trivial problem, and it's only getting worse. So you can see that there are many hazards, many hazards of climate change, extreme weather, driven by human-caused climate change. So knowing how harmful this is and that human lives are endangered, I find it ironic that this summer, the EPA, the new EPA under the Trump administration, has proposed a rule change to the endangerment finding. The endangerment finding was a Supreme Court ruling in 2007 that there was enough evidence that showed that climate change was harmful to human health and welfare, which would require EPA to regulate greenhouse gas emissions under the Clean Air Act. The EPA was asked by the Supreme Court to conduct its own assessment, which they did. And the EPA assessment came out in 2009 in agreement with the Supreme Court. And you had the endangerment finding, which meant that greenhouse gases had to be regulated. But now the Trump EPA, they have some arguments. They're saying, well, number one, the largest emitter in the United States, which is transportation, on a global scale, our US transportation emissions are insignificant. So why bother, right? They also say there's too much scientific uncertainty about the human health risks of climate change, too much uncertainty to warrant regulating greenhouse gas emissions. And you can see here, this is the document that came out this summer in July to reconsider the endangerment finding. Well, a lot of people were upset about that. And the National Academy of Sciences, Engineering, and Medicine pulled together a rapid assessment, a rapid consensus report, which found that, well, here's the report. I'll give you the findings in a minute. So the National Academies came together At the same time, 114 climate health scientists across 31 states in the United States pulled together an expert working group on climate change and health in the United States to put in public comment to argue against the EPA's proposed rule change. Now, the first finding, if you take a look at U.S. transportation, the largest emitting sector, the emissions here in blue of the U.S. transportation is greater than all but 3 countries' total national emissions. So U.S. transportation has more emissions than any other country in the world except for Russia, India, and China. So EPA was wrong there. Here's just one health outcome, just one example of how much more evidence there is that this is harmful. So burning, this is a study on the left from the Proceedings of the National Academy of Sciences, showing that the area of wildfires that have burned in the Western United States is twice what it would have been without human-caused climate change. And that human-caused climate change is responsible for more than half of the observed increase in forest fuel aridity. So, tinder to wildfires, the drought conditions and setting things up. So definitely increased risk of wildfires. And the week this public comment was submitted, a group out of Stanford has a new study showing the county level projected increases in annual deaths due to wildfire smoke. So this is just one example that definitely there's more evidence of harm. So those two counter reports against the EPA's proposed ruling, the National Academy basically said EPA 2009 finding that human-caused emissions of greenhouse gases threaten human health and welfare was accurate, has stood the test of time, and is now reinforced by even stronger evidence. And the working group showed the vast amounts of new scientific evidence since 2009 reduces the uncertainty. So that the EPA was just really, they were very incorrect. And in fact, coming out tomorrow in The Conversation will be an article that talks about this. It's a short, very accessible article. I encourage you to check this out tomorrow. It should come out tomorrow morning. Want to make America healthy again? Stop fueling climate change. So why do I think that climate action is a health intervention and that, in fact, could represent one of the greatest health opportunities of our times? Well, think about the energy sector. More than 8 million people die prematurely from air pollution. And of that 8 million, more than 60% come directly from burning fossil fuels. That's more than 5 million premature deaths every year from burning fossil fuels. So clean energy, millions of lives saved. I don't have time to talk much about the food sector, but we know that the Western diet that is high in meat is hard on our arteries, but it's also hard on the environment. And if the world were to adopt the universal healthy reference diet, quite similar to the Mediterranean diet, very little red meat, more fruits and vegetables, and a diet that all of you would know, that would save 11 million deaths every year. And the transportation sector, physical inactivity from automobile-dependent lifestyles is a problem, leading to sedentary lifestyle. And it's known that from walking and biking, that increases exercise, and that could save 4 million lives every year. So you add up those numbers, that's a large portion of all premature deaths every year, just across these three sectors: energy, food, and transportation. So let me show you with energy. Um, the United States has this wonderful Clean Air Act, and so air quality here is really nice compared to many places in the world. But even so, we still have coal-fired power plants. This is a map of where they are, and it's estimated that 1 to 200,000 Americans still die prematurely every year. So that really is a problem. That even though we have the Clean Air Act, we still have much improvement. And if we can get off of dirty energy, we can save many lives. But policymakers, they argue, they say, we don't want to pay for that extra, the clean technology. We can't afford it. But if you were to not emit 1 ton of CO2, not burn coal or oil and emit the 1 ton of CO2, you're also not emitting the dangerous particulate pollution, the sulfur dioxide, the mercury, nitrogen dioxide, all those known harmful pollutants. And so I asked the policymakers, if you look at the health benefits from clean air and you compare this $200 to this $30, I asked them, this is a really tough question for you. Which number is bigger? And many policymakers say, well, we haven't thought about the health benefits. We just don't want to pay more for energy. But the thing is that $30 is probably way off now. And why do I say that? Look at the price of solar energy. This is from an expert, Greg Nemeth, expert in solar energy. And he shows the price of photovoltaics has dropped 10,000-fold in the last 67 years. It's dropped 90% in the last 15 or 20 years. So just incredible price drop. And as of 2019, the cheapest way to generate electricity is from renewables and batteries. So if anyone says to you, yeah, we can't afford renewable energy, that is an old argument. It is a false argument now. And there's just no excuse. We're not waiting for the solution. The solution is here, especially for energy. My group conducted a study looking at the scenario of getting away from fossil fuels across the major sectors, looking at energy, transportation, industry. And if we were to get off of fossil fuels and replace these with cleaner energy sources, we would save more than 50,000 lives every year from clean air quality. And if you recall that map where the coal-fired power plants were in the Ohio River Valley, you can see here for our map, the darker the blue, the more the benefit from reduced fine particulate matter. If you translate some of this to direct health outcomes, this is looking at the state of Wisconsin. You can see that, we would avoid almost 2,000 deaths every year, tens of thousands of asthma exacerbations, 650 heart attacks. And if you combine the reduced fine particulates and ozone, you would save $21 billion every year in avoided deaths and hospitalizations from air pollution in Wisconsin. Transportation sector. The cities with the highest rates of walking and cycling to work have lower chronic disease, lower obesity and diabetes rates. And we all know that exercise is really healthy. Contracting muscles are not just burning calories, they are chemical factories for chemicals that reduce heart disease, cancer, dementia, and depression. And looking at my city, Madison, Wisconsin, where we are platinum rank for bikeability. If America had our level of bicycle commuting, that would save about 20,000 lives every year. So it begs the question, isn't it time we design cities for people instead of for cars? And by the way, e-bikes are having a major advance as far as mobility and sustainable transportation. And e-bikes are slashing oil demand much more than electric cars at the moment. So another some good news there. But speaking of good news, we have bad news. We are now experiencing some headwinds with the new administration. Um, Here's an example. One of the largest solar projects in the world in the Nevada desert just got canceled. The Trump administration is completely against wind energy, and they're requiring coal fire power plants to stay on. You know, when they were scheduled to close, the new administration is saying, no, we want you to keep operating another 2 years, as one case in Wisconsin here. So when I see this, I ask the question, America last in modern energy development? And what about the human costs in health and jobs? So my team in our lab, the Climate Solutions for Health Lab, we are now analyzing these reversals, and we're going to be showing how much health damage is happening by reversing these steps forward. There are also states that are moving forward, modeled after California's Climate Corporate Data Accountability Act that requires companies to report their greenhouse gas emissions. These are the other states that are proposing to follow that. And of course, your neighbor, Vermont, was the first state to pass a climate superfund law that requires fossil fuel companies to pay for damages. And now that we have much better attribution science and ability to say, hey, that heat wave, that storm, that was, caused by climate change. We have better attribution science. So, Vermont passed this Superfund law holding oil companies liable for damages. And following Vermont, New York did the same thing. So these are two incredibly important bills that have been passed by states. Of course, no surprise, the Trump administration is going after these state laws. So this is a battle that's brewing right now. One other thing to know about, I'm sure you know about the lawsuit in Montana, where the youth filed a lawsuit against the state of Montana for not taking into account climate change in their energy decisions. And those children won that lawsuit, went to the state Supreme Court, and they won the lawsuit. This is being replicated in other states, Hawaii, Illinois, and as of just a few months ago, Wisconsin is now doing the same thing, and there are 15 youth that are suing the Public Service Commission that prohibit the Public Service Commission from considering air pollution, including greenhouse gas emissions, when they are deciding to approve fossil fuel power plants. And so these young children, actually, I think they're age 5 to 17, they're arguing that the state's active promotion of fossil fuels is harming their health, endangering their homes, and threatening their futures. So stay tuned for that. So I want to just tell you that as much terrible news you hear, and there's so much disinformation, we are, swimming in a sea of disinformation. You should know your audience, and you should know that as of a couple of years ago, a majority of Americans are either concerned or alarmed about climate change. In our state of Wisconsin, 70% of people in my purple state are either concerned or alarmed about climate change. So even though the squeaky wheel gets a lot of attention and the dismissives here, that's only 11%, they're very loud, recognize that the majority of Americans really are concerned about climate change. So one of the first things that you should do is to keep talking about climate change, amplify it as much as possible. Um, and a lot of people running for office, they want to know what people are thinking about. So really, we need to be louder and talk about climate change, and also talk about climate change as a health issue. There's more common ground around health. Also, and simplify your messages. This is from a colleague, Ed Maybach. He's a communication scientist. He says you can do this in 10 words. Global warming, it's happening. So it's real. It's us. The science shows that it's actually human caused. It's not sunspots and volcanoes and ocean cycles. The climate scientists know all about those different cycles, and they can discern that it's us. We are causing this. Um, Climate scientists that are working on climate change agree. So the qualified experts agree. We know it's bad news. I showed you the health harms, but there are many cross-sectoral harms, but there's hope. And I hope I showed you some examples of why climate action can really be the biggest health opportunity of our lifetime. So I just want to end on a note to say that today we have the opportunity of a lifetime to seize this moment to transition away from fossil fuels and at the same time vastly improve our health. So with that, I thank you for the honor of presenting to New Hampshire Healthy Climate. And I am open for questions. I will stop sharing and then we can go ahead and have questions.
Thank you, Dr. Patz, for a very thorough, complete, and compelling argument about why this is so important. I'm happy to say that New Hampshire Healthy Climate is with you on so many of these points. We do have a speakers bureau that also goes out and makes a lot of these points in our communities. And we write literacy letters and opinion pieces and what have you. So we're in the fight with you and some of the people you mentioned, like Ed Maybach, who we know well, and others. So we're colleagues, and I'm very glad to report that. Um, Couple of quick things. One is I learned a new phrase. I've been giving these talks as well, and I never heard the phrase hydrologic extremes, but I like that. From drought to floods mixed in. We are wetter here in New Hampshire. We do have that 10 to 15% increase. We have had some extreme flooding in recent years that really shock us. But we've also had extreme drought this summer too, and other summers as well. So it's really the extreme aspects of climate weather in climate change. That really is impacting us in so many ways. Second small point, it's time to update one of your slides, that with the coal plants around the U.S. Just this past month, we have officially closed our last coal burning power plant. It was a peaker plant in Bow, New Hampshire, and I say somehow it was too far along for the Trump administration to revitalize it, revive it. I think it's closed for good, and it would be too expensive to bring back. So we're very, very happy for that as well. Um, I'll start off with the first question because I saw on the news this week that Wisconsin is being promoted or inundated. I don't know what verb to use with AI data centers and all the electric power consumption that's going to be require. And I wondered whether you had any recent update for us about how that's playing in Wisconsin.
Right, right. It's a huge elephant in the room out here in Wisconsin. So um, I know this is happening in many other states, but I'm interested to learn from you in New Hampshire that you saw something that points to Wisconsin, that we're a hotspot for data centers, because I know we are grappling with it.
Mhm.
And yeah, it's a hot topic, and so the question is, can can they be powered from clean energy? And so there's big debate about that. One concern is their backup energy with diesel generators. That would be really bad news. So we are in the middle, or I'd say early stages of grappling with this new challenge of data centers and then the energy demand for them. Um, I can tell you from the energy experts, not being one myself, but the energy experts tell me um, that the concern for base load energy is way exaggerated, and that there is plenty of energy, and that renewables and batteries. I can't tell you for sure that they can absolutely handle the data centers, but I can tell you that the cheapness in price and the ability to quickly put up renewable energy compared to other types of energy, um, it still should be the way to go. I'll say that I saw recently the state legislature. I think I just saw yesterday that the Democrats are trying to propose a bill that will require data centers to run 70% of their electricity, to source that from renewables. That would be awesome if something like that passes. So we are looking at different scenarios to figure out how to power them safely. But it's certainly a challenge. Um, and of course, there's the water demand too. So people are worried about all the water and the water cooling that's going to happen. So,
Well, that 70% renewables bill sounds like a great bill, and I wish it luck. There's a question from Mary. Mary, you could either unmute and ask it yourself, or I could read it.
You started to talk earlier, Dr. Patz, about what kind of storytelling being effective. And I wondered if you could talk a little bit more about that, where you find storytelling effective and what kind of storytelling to what kind of audience.
right, right. You know, number one is the messenger needs to be a trusted messenger. So the idea of disseminating information to influencers, to um, people that a community look up to. So, getting in front of the right types of leaders to then take on this information is important. But the storytelling, as you know from Ed Maybach, the most trusted messengers are nurses, followed by doctors, followed by scientists. But nurses are number one. So having nurses, as the messenger. And I know from our own Healthy Climate Wisconsin, doctors and nurses telling about their patients with asthma, or how their own patients are experiencing climate change. Those are some of the narratives that are cutting through. Um, and so I think that's just one, the right messenger, and bring in some of these stories where people are really affected on the ground.
Right.
Dr.
Um,
Patz, I have a question. If I
Sure.
Hello there. I'll just introduce myself. So my name is Krista Romero Cardenas. I'm actually a student at University of Arizona Natural Resources and Environment. My master's is in public health, though. And so excellent presentation. I really like how you married these things, which is how we should be looking at these big, complex, wicked issues. Um, my question, it's kind of a two-parted question, and I also wanted to share some information with the group. I had the opportunity to go to a couple conferences this summer, the National Fish and Wildlife Conservation Conference, right before the federal shutdown. And so, not I when you were saying the nurses and the messaging, it also makes me because I use a One Health framework. So I incorporate environmental health, wildlife, animal health, and human health. And that provides me a huge arena of how to address issues depending on who I'm speaking to, and has allowed me to really diversify that argument of why you should care. But so what I've seen from Fish and Wildlife, not only are there $0 going to conservation and they lost a lot of their workforce, but what I saw is they're getting lobbied really hard by big tech to start incorporating artificial intelligence to help them do their work. Similarly, I had the opportunity to go to the Public Health Association conference last week in DC. And also, so both my fields are getting guillotined, right? But what we're seeing is specifically for data centers is it is very strategic to go and almost go shopping through the states. And my background was in business. I used to be dark side before I went to public health, but that's a different story. But it's really smart because they shop around with NDAs. They see where they get the best deal. They actually still get some tax incentives. And we're seeing communities stand up. So for example, in Tucson, Arizona, which is where I'm from, I'm part of a group that's trying to stop the data centers here. And we did all the correct political things where we spoke with not only city council and board of supervisors individually, but we also had expert testimonials, all different ages, colors, people, and we're seeing that that's not working. So what I guess my question to you is, and what I would ask the group is, should we, instead of trying to take a federal approach right now, should we be looking at using state power to start like instilling these, which were federal policies at a state level to hold accountability? Because the last 2 years I've been studying NEPA, the National Environmental Policy Act, which was kind of the only thing that would pause and make us pause and look before we started these projects. And so, what are your thoughts on that? Seeing that, should we go to state power and in a place where we are now seeing, I don't want to say everyone's getting sold out, but that's how it's looking. What would you propose for making sure we're protecting like our environment and our natural resources? And it all adds up to health. So, what do you see?
Yeah, Krista, great question, great comment. Um, so absolutely, I would pivot to local. You know, the work at the federal level is going to be in the courts.
Mm,
I can tell you right now that I know that the EPA, someone told me today in a meeting that
mm,
the EPA received 500,000 comments against, their proposed reconsidering the endangerment finding.
mm,
Um, and of those comments, one was a National Academy consensus report, and the other was a 50 pages of evidence from 114 climate health scientists. And then
mhm,
for another, you know, 499,000 comments. Um, the EPA is going to ignore that.
mm,
I think what I heard from a lawyer is that they're going to try to make a final rule before the end of the year, which means there's no way they're going to really
no.
address the comments, and they'll be taken to court. So at the federal level, these fights are going to go. They're going to go to the Supreme Court, which who knows, our Supreme Court. But I think I still think at the Supreme Court, that's going to be a hard fight for the Republicans to win that. I mean, I don't know, but so at the federal level, it's in the courts. So where we really should do a lot at the local level.
Mhm,
Wisconsin, we have a Democratic governor, we have a Republican legislature, we have a Democratic Supreme Court, and we now have sort of fair election maps. And the Democrats are poised to take over the state legislature. So there's a lot of effort to talk to people in my state. And I'd say do as much as you can at the state level, because what happens in the states can really lead. Those two climate superfund laws in Vermont and New York um, are incredibly powerful, and it's why the federal government is going after them, which who knows what, I'm not a lawyer, but it's like, sounds crazy. There's usually they're talking about states' rights and how could you overturn a state law, but this federal government is, they're going against it. So anyway,
Thank
state,
you.
local level, and also join forces as,
Yes,
as,
I'll be reaching out, Dr. Patz. And
sure.
sorry, I also just learned one last thing for the group. New Jersey just passed the first cumulative impacts law. So the idea is to not just look at, how NEPA, we only evaluate one project at a time. They were focusing on environmental justice, so they were incorporating that human component, but just putting that on your radar because I know I'm going to be looking at that legislation and seeing what we could do to duplicate it. Thank you so much for your talk.
Sure.
We're going to get at Maisa's question in just a second, though. I just wanted to comment from the New Hampshire perspective. It really depends on the state. We cannot do things at the state level here for multiple reasons. The state politics is very dug into climate change denial and fossil fuel promotion and what have you. But so here, our action really has to be on the municipal level, sometimes the regional planning level, but we don't have a state government that can do that. I mean, California is leading the way, other states, Washington, Illinois, Colorado, what have you, New York. So if you have the state infrastructure to do that, by all means, use the state. That's not the
Mhm.
case here in New Hampshire by any means.
Well, Mr. Paul, if I may challenge you, I mean, to use other components because maybe they might not focus on the health one, but I believe New Hampshire is actually pretty big on wildlife. And also, you guys have a pretty large angler community. And so maybe coming at it from that perspective might be helpful. And then there was something else I had and I just lost it. But
Those are good points, and
oh,
it's harder for environmentalists in New Hampshire to deny climate change because they see it when they're out in the environment. There's no doubt about that.
yeah,
We
no.
can move on and give Misa a chance. Misa, you had a question.
Yes, hello everyone. Thank you for the organizers. Thank you for Dr. Pat for an amazing, compelling presentation. I have a question along the same lines like Krista's comment, but more heavily on what can we do next. We deal with the drip, which is data rich, as we saw in the presentation today, and information poor. So when I mean information poor, it means at the people's level. We still have these debates and arguments. Is there a climate change? Is it not? Even though data speaks loudly and screaming, and we're experiencing disasters after disasters, whether it's heat, extreme heat. I'm a professor at Arizona State University, live in Phoenix. 3 months now in the summer are becoming intolerable, 118 degrees nonstop. Plants are dying, insects are dying, birds are dying, a lot of deaths because of heat strokes. Anyway, so my question is, how can we switch this or use this data rich to information rich, not poor, mainly having masses, mobilize people at the people's level to create a change. Relying on politicians, it seems, and policy change, it's going to take forever. Thank you.
Yeah, thank you for that. And Mary and Paul, I think New Hampshire is being invaded by Arizona, it looks like, on this webinar.
Hey, around the world, we accept everybody.
You're welcome. Arid lands are expanding, so hope you're lucky to have us.
So one quickly, just to channel Bill McKibben, who says the first thing an individual should do is to be less of an individual. So join forces. So make your voice louder by joining forces. Number one. Number two, absolutely, we we need to engage expert communicators. Not all of us can communicate well, as I'm going to take a sip right now and clear my throat. perfect parallel process. Anyway, so not expecting that scientists can all communicate well. We need to, yes, we need to be better communicators, but we need to engage with the communication experts. You know, I was at a recent meeting and someone said, we need to have better communication. And someone else said, no, there's an information war. We need to go to war and be really strategic about information, about communication, not just communicate better, but have strategies. And so I would just say, because I'm not a communication scientist, I would say we need that engagement. We need to be communicating in the right venues and the right media. I asked my students, where do you get your news? And I heard TikTok, Reddit, so it's not the typical places. So we have to be in those places. And so I would say engage the experts in communication. One step is this thing that's coming out tomorrow in The Conversation, which, they bring to, I love that byline of academic rigor, journalistic flair to make it accessible. We need more of that. So huge need. We also should call out disinformation. There's a climate scientist, actually a communication scientist I met in Australia, John Cook, who has an acronym. It's called FLICC, FLICC, which is fake experts, impossible expectations. I'm sorry, fake experts. L is logical fallacies. I is impossible expectations. C is cherry picking. And the other C is conspiracy. And all disinformation has one or multiple of those tools that they use. So it's really important when you talk to someone. If you're talking to a climate denier, forget it. That's the cranky uncle. You can't penetrate. More evidence does nothing. But if you're talking to someone who's wondering or in the middle of the road or possibly will listen to you, you don't insult them, but you ask them, where did they get that information? And then you can point out, well, that person's actually not a climate scientist, or that's a cherry-picked study, or, think about that FLICC acronym and call out the bad actors that are disseminating the false information intentionally.
Great. Thanks so much. Again, a wonderful presentation, wonderful questions. We are coming up on our 60-minute limit. I just wanted to end by saying two things. I think, Krista, it's important that we try to get a bipartisan approach to these solutions. So it can't be a us versus them. We got to get bipartisan. And Krista, your point is very well taken about involving the anglers and the hunters because they are seeing these impacted as well. The second and most critical point, I think, is what Dr. Patz made so well. We have to talk about cost. The cost of cleaner energy being considerably less, especially with the health impacts, than the cost of dirty fossil fuels. And we got to hammer that home. I love your phrase, America last, because we really are heading in that way with China's hegemony here in clean energy. And the world is following China. They're not after us. They're not eager to build more coal and fossil fuel and gas plants the way the Trump administration wants Americans to do. So let's not be America last on this, and let's talk about the cost and hammer home the cost. So thank you so much for attending. And I want to point out that we encourage people to join us as volunteers at New Hampshire Healthy Climate. Our website